you?
I'm good. How are you?
Good. I'm Peter.
Nice to meet you. I'm Ariana.
Nice to meet you. I'm here for my diabetic clinic appointment.
Perfect. You can have a seat. We'll get started shortly.
Awesome. Thank you so much.
Hi Peter, I'm the pharmacist of this diabetic clinic. So we prepared this booklet. This is all the information that we're going to present this afternoon. You can take it home as a reference too.
Oh, great. Thank you so much. That'll help a lot.
You're welcome.
Hey Peter, my name is Shane. I'm an RPN.
Hi, my name's Ariana. I'm also an RPN here.
Hi Peter, I'm Denise and I'm the pharmacist of the clinic.
We see that your doctor has prescribed you new medication, so we kind of want to explain how it works, how to take it, and this is a PowerPoint that we prepared for you.
Great. Let's get into it.
Okay Peter, I just want to explain to you how sitagliptin works.
Okay.
I know it looks like a lot.
Yeah.
But essentially what it means is that when you eat, your body releases this certain hormone that increases the insulin levels in your body, which helps control your blood glucose levels.
Okay.
However, there's also an enzyme or a substance that breaks this hormone down quickly. And that's where sitagliptin works. It prevents that breakdown of the hormone, which allows the body control the blood glucose level better.
Great. I thank you for explaining it like that. That was a lot easier to understand than these acronyms that I see here. And I enjoy that you put it in the teaching guideline here too. Thank you so much, Denise.
You're welcome. Okay, Peter, why is sitagliptin right for you? So it is right for you because it is an appropriate second line therapy to metformin, which is you're already taking. It produces a complementary effect in controlling your glucose levels.
Okay.
It has also a strong safety and efficacy profile, meaning it has a low risk of hypoglycemia and serious side effects. It's neutral on weight, its modest effect on A1C levels. And as per Diabetes Canada's guidelines, other second-line drugs are more appropriate when addressing like heart and kidney failure, cardiovascular disease risk, and weight loss.
Yeah, that makes sense. Things that I don't have, right? So I don't
Yeah.
need to be on this medication.
And this is a very important part of the presentation, how you should take the medication. So the medication is taken orally. You have to take 100 milligram oral tablet. You can take it either with or without food.
Okay.
It should be taken daily. Take the medication once per day, in the morning, at the same time each day. And you should also take it together with the metformin.
Okay.
And if ever you miss a dose, take the missed dose when you remember, but do not take 2 doses simultaneously. You should contact your doctor or poison control if you believe you have taken too much of that medication. And if there are any adjustments, your dose may be adjusted based on increased stress, if you have infections, or any surgical procedures.
Okay, so should I probably just get in contact with my doctor if I'm going for a surgical
For
procedure?
sure,
that
yeah,
sort of thing?
that's
Okay.
very important.
All right, great, thank you.
Alright, so another benefit of taking this medication is that it increases or improves your A1C level from like between 0.5 to 0.7 points.
You know, Shane, it's been a long time since I was prescribed metformin and I had my teaching on A1C. Can you go through that again with me, please?
Yeah, so A1C, it's a blood test that we take around every 3 months or so, and it basically gives us a better picture of how well your blood sugars are being controlled by the medications that we have prescribed for you.
Okay, awesome. Thank you so much.
Now there are some common side effects, just like every other medication. Those include cold-like symptoms like runny nose, headache, sore throats, and respiratory infections. Also can affect your gastrointestinal systems, making a bit nauseated, diarrhea, gastric upset. And I know that you're taking metformin.
Right.
One of the things to look out for is the swelling of your hands and legs. There are also some severe side effects. Hypoglycemia, that's when your blood sugar is too low. Kidney injury, severe joint pain, and And there's this disease called bullous pemphigoid. It's that blistering of the skin. Also allergic reaction, just like any other medication you haven't had before. So you definitely want to call 911 if you have any hives, swelling of the face, difficulty breathing and wheezing. And with this medication, there's other severe side effects, such as pancreatitis and heart failure. Now, pancreatitis is a more serious condition. Pancreatitis is infection of the pancreas, so some symptoms would be vomiting, abdominal pain that radiates to the back, and as well for heart failure, some symptoms would be like shortness of breath, weight gain or swelling of the feet, and fatigue as well.
So I noticed back when we talked about the common side effects that taking metformin can cause swelling of the hands or legs, so I should be calling regardless, even though that is potentially a common side effect, because we wouldn't really know that
Yeah,
if it's
it could-
due to the medication or if I'm experiencing heart failure.
exactly. So
Okay.
something we would want to monitor first before it gets worse.
Okay, great, thank you.
Next, we're gonna go over what hypoglycemia is. So essentially, it's when you have low blood glucose levels, and it's characterized as 4 millimoles or less, but it's just low blood glucose levels. And it can occur for lots of different reasons. So one of them could be from taking excess medications, such as the Januva or sitagliptin that you're now prescribed. It can also happen when you're consuming too much alcohol within like the past day or so. And then it can also be due to increased levels of exercise, or if you're having a decrease in your food intake, or if you're missing some meals. Now, by any chance, do you know what some symptoms of hypoglycemia are?
It's been a while since I had my teaching, but I know some of them could be fatigue, hunger, a fast heart rate, but I'm wondering what are some of the other signs and symptoms?
Oh, okay, perfect. So we'll go over that. So these are some symptoms. So you picked out some really good ones. So as the chart shows, some symptoms include like swelling, some trembling, you might have palpitations. You can also have some weakness or dizziness, some vision changes. So if you're experiencing any of these symptoms, you want to make sure that you're monitoring them. And then you can contact the doctor if it continues for like more than a day or so.
Okay, I like how you set up the severity so that I know which ones to really watch out for. So I'm wondering then, Ariana, how would I treat this if I were to get hypoglycemia?
Well, that's a good question. So we have this chart here. This is also in your reference manual, so you can use this at home. So once you have hypoglycemia and you're experiencing those symptoms, or you're just checking your blood glucose levels, you're going to want to increase your sugar levels. So you can do that in a few ways. So here it shows like you can drink some juice, you can have some honey or some sugar and water. Then you're going to want to wait the 15 minutes and you're going to recheck your blood glucose levels. And then the chart will just go over what to do. If you're having continued symptoms, you want to make sure that you're going to reach out to your physician if it's continuing for about a day or so.
Okay, good. I'm glad that I bought a glucose monitor then. It should come in real handy.
Oh, for sure. These are some monitoring parameters that you want to go through. So as the other nurse Shane went over about the A1C, so you're going to be checking this to see how your sugar levels are kind of overall. So if you're meeting good glycemic control, meaning that your sugar levels are good and they're in like the range that we want them to, then you can just get this done twice yearly. But if you're having a little issues and when the sugars aren't exactly how we want them, we might have to do it on more of like a quarterly basis. And then for your serum glucose, you're going to be checking this prior to the initiation of the medication, which I'm pretty sure that the doctor has already done that with you. And then the doctor will then tell you how often you need to be checking. And then they're also going to do a test for your kidney function, because the medication will also require that you have adequate kidney functioning. So I'm pretty sure that your doctor has already got this started for you.
Yeah, as far as I'm aware, I don't have any kidney issues, but we're gonna get it checked anyway, right?
Perfect, that's
Okay.
awesome.
And it would seem to me like because I'm getting put on sitagliptin, we're probably gonna have to be doing quarterly glycemic control with the HB1C.
Yeah. Yeah, the doctor did say like the levels aren't very good, so you are using the metformin, now you're using the sitagliptin. So
Okay.
for the first year, we're probably gonna be starting with the quarterly,
Yeah.
and then as long as after a year it's good, then we might move to the twice yearly.
Okay, perfect, thank you.
Alright, so these are some important teachings that we want to go over. So the first one is that you're continuing with your lifestyle management. So when you got your diagnosis of diabetes, the doctor had already gone over that you need to change some things in your life. That includes like diet and exercise. So this medication, it is an adjunct, which means that you have to use the medication plus continuing the lifestyle management.
Okay.
So you're going to continue that. You also want to make sure that you're monitoring for those severe and adverse effects that the other nurse went over.
Yeah.
And then make sure you're reaching out to your doctor. And if it's a real emergency, make sure you're calling 911. And then you also want to make sure that you're taking the medications as prescribed and never abruptly stop taking it. If you feel like you're going to want to stop taking it, you have to reach out to the doctor.
Okay.
Because if you stop it abruptly, it can cause some serious effects. And then you also want to make sure that you're monitoring your blood glucose regularly. So the doctor will go over how frequently you need to be doing this. So just make sure that you're following it as prescribed.
So it would seem to me then that I don't actually have to check my glucose level before I take this medication every day. That it's just going to be as the doctor says.
Exactly.
Okay, very good.
The only times you want to check it is if you're then experiencing those hypoglycemia symptoms.
Yeah, good.
Alright, well that concludes our presentation. So we just want to go over the key points that we discussed.
Sure.
Yeah, so as we discussed earlier, we mentioned that sitagliptin is an added medication. So since you're taking metformin, this is an adjunct to metformin. And as we understand that you were prescribed 100 milligram of sitagliptin,
Yep.
just take the medication as prescribed by the doctor.
And you also want to monitor for those side effects again. Some could be more severe than others, and you want to call the doctor if there's any changes. But if you do experience the severe side effects, you want to call 911 and go to the hospital.
And then again, so you want to make sure that you're checking your blood glucose levels as per what the doctor prescribed. Unless you're experiencing those hypoglycemic symptoms, you can always check it again. And then just a reminder, never to stop taking the medication abruptly. And if you do, make sure you see your doctor right away.
Okay, great. Thank you so much. This has been a very informative presentation. Ladies, thank you.
Thank you.
Thank you.
Nice meeting you, Peter.
Nice meeting you.
Nice
Thank you,
meeting you.
Denise.
Nice meeting you.
Juliana, Shane, thank you so much.
No